We will now get started on the second learning objective, explaining why personalization is an effective method for persuasion using the elaboration likelihood model. Now that we have established what we mean by personalization, we can think about why we would want to personalize. What is it about a mailing list that starts with our own name that makes us click on it? Or what was it about the Kamade lesson, the movie promoting cervical cancer screening, that increased the rate of screening from 32% to a whopping 82%? While research that explores the working mechanisms of personalization is still emerging, and there are other theories out there, the main explanation as to why personalization works comes from the elaboration likelihood model, or ELM in short. This prominent model of persuasion was developed in 1986 by Richard Petty and John Cacioppo. I will explain personalization effects using this model and the example of Lustrea and her colleagues' 2016 study of a tailored intervention to promote testing for sexually transmitted diseases, STDs, among young adults. This paper is also a part of the additional reading materials. While it discusses tailored messages, the theory is also applicable to targeting and customization and to products, service, or other materials. The ELM states that there are two pathways or routes through which people process persuasive materials. Each pathway consists a different way in which editing can be changed, but so that the desired behavior change occurs. The first pathway is central route processing. Central route processing is a form of processing where people think deeply about the content that is presented to them and evaluate the message against prior knowledge. This form of processing is considered the most effective for producing a lasting behavior change. However, for central route processing to occur, people need both the motivation and the ability to think about the content deeply. The other pathway of processing is verifical route processing. In verifical route processing, attitudes about the subject are formed via simple heuristics or cues. For example, the attractiveness or authority of the speaker. In a healthcare context, this is seen in the value of the white coat. For verifical route processing, neither motivation nor ability is required to produce behavior change. However, the attitude change produced through this mode of processing is superficial, and behavior change may not last. Personalization is thought to improve processing in two ways. First, tailored material is typically seen as more personally relevant than non-tailored material. And the nice thing is, people are more motivated to process information that is relevant to them. Therefore, personalization is effective because it improves motivation for central route processing. As long as people also have the ability to process, it is expected that lasting behavior change will occur even if the subject was not intrinsically motivated before. Secondly, the process of tailoring, in which a closed system produces a message, a product, or a service that just magically fits our characteristics, is considered engaging and attractive to most people. Especially in an explicit assessment, that is when a questionnaire is used, people are engaged for a longer period of time before receiving the final product. Via the verifical route, these simple biases of attractiveness and involvement may still lead to behavior change, even if the ability to process is not there. Let's clarify this with the example of Lustrea and colleagues' intervention. As I said before, the intervention used in their study aimed to improve STD testing in young adults. Participants in the study filled out a questionnaire, and on the basis of this questionnaire, they received a combination of messages, testimonials, feedback, and images that matched their pre-test on gender, relationship status, sexual activity, and their perceived risks of STDs. They spent some time on the website, and they were reported on various aspects, including the extent to which they considered the website personally relevant, and the extent to which they enjoyed and paid attention to it. Using this setup, Lustrea found evidence for the explanation of tailoring effects as discussed earlier. Young adults who had viewed the tailored website in comparison to a standard website found it more personally relevant and in turn paid more attention to the content and elaborated about it more. All this deep thinking made them feel more at risk of the STD, and in the end, these young adults were 1.5 times more likely to have ordered an at-home STD test than the participants who had viewed the standardized website. By now we have discussed what personalization is and what makes it such an effective technique to improve the attention, relevance, and enjoyment people derive from your products. We have also seen one example of how personalization techniques can be used in clinical settings, in the STD screening study.